The Newsday continues here on One News Now. I'm Charles Lejano. A total of 50 economic frontliners were inoculated at the symbolic vaccination of the A4 priority group at the SM Mall of Asia in Pasay earlier today. The vaccinee is composed of several essential workers, including government employees, teachers, travel guides, and drivers, as well as fast food chain crew members, celebrities, and reporters from the Malacanang Press Corps. Part of the activity was the simultaneous pledge of commitment of various local executives from the NCR Plus 8 as they adhered to the call for a quick and efficient vaccine rollout. In a taped message, President Rodrigo Duterte praised the government's efforts in procuring vaccines.
We can now see the light at the end of the tunnel as the vaccine shipments have started to arrive in bulk. But we must also remember that getting vaccinated is not the only solution. We must continue to observe minimum public health standards.
Some women are still hesitant on getting vaccinated against COVID-19 due to fears arising from fertility and pregnancy. The WHO answers these concerns and explains how vaccines are safe. Let's watch this.
Soumya, my first question to you is women who are breastfeeding infants, what is the advice? Should they get vaccinated?
Yes, the answer is yes. So women who have given birth and who are breastfeeding their babies can take the vaccine, should take the vaccine when it becomes available to them. There is no risk at all because all the vaccines that are being used presently, none of them have the live virus in it, and so there's no risk of transmission through the breast milk. In fact, the antibodies that the mother has can go through the breast milk to the baby and may only serve, maybe to protect the baby a little bit, but there's absolutely no harm. It's very safe. And so women who are breastfeeding can definitely take the vaccines that are currently available.
Soumya, what about women who are pregnant or are planning to get pregnant?
Yeah, that's really important because pregnancy, of course, is a very special situation because we're concerned about the health of the mother, but also about the health of the fetus, the unborn child. And so any drug or vaccine that is administered during pregnancy, we always take special care to make sure that there is no potential safety concern or any adverse event. In the case of COVID, we know that pregnant women are at higher risk of getting severe COVID and also at higher risk of delivering a baby prematurely. So in situations where there is a lot of COVID transmission in the country and the woman is exposed to it, or if she's in a profession like a healthcare worker or a frontline worker where she's at especially high risk of acquiring the infection, the benefits of getting the vaccine definitely outweigh the risks, particularly since the platforms that we used currently for vaccines are the mRNA platform, inactivated viruses, or the viral vectored platforms or subunit proteins. None of them have a live virus that can multiply within the body and that could potentially create a problem. So I think it's important that pregnant women in every country be explained the benefits versus the risks and be offered the vaccine if they would like to take it. And it's probably the right thing to do in many situations, as I said, where the pregnant woman is at higher risk of getting the infection and where the vaccines would bring more benefits.
Soumya, we hear a lot of misinformation about vaccines and fertility and infertility. Could you please explain the science behind this?
Yes, it's a common myth, and I should start by saying that there is absolutely no scientific evidence or truth behind this concern that vaccines somehow interfere with fertility, either in men or in women. Because what vaccines do is they stimulate an immune response against that particular protein or antigen of that virus or bacteria. So in this case, the COVID vaccines stimulate both antibody response and a cell-mediated immune response against the spike protein of the SARS-CoV-2 virus. So there is no way in which they could interfere with the functioning of the reproductive organs in either men or women. So I think people can rest assured that these vaccines in no way interfere with fertility.
While the vaccine rollout for economic frontliners is ongoing, The health department stressed the need to continue vaccinating members of the A2 and A3 groups. That's because these sectors remain vulnerable to getting severe complications from a COVID-19 infection. To give us more updates, we have Jen Calimon joining us live from Malabon. Jen, good afternoon. Now that vaccination has been expanded, do we have any updates on the possible vaccination of children, especially since China has already approved the use of Sinovac for those aged 3 and above?
Yes, Charles, the Department of Health welcomes this development in China, but DOH Undersecretary Maria Rosario Berheres said that the agency will only be open to expand our vaccine coverage once there is already a concrete evidence that these vaccines are indeed safe and effective for children. So once trials of the said vaccines are completed and are submitted to the Philippines, our government will study the revisions of EUA for Sinovac. Charles.
Right. Could you tell us until when this vaccination program from the A1 to A5 sectors is scheduled to last?
Well, Charles, that will depend on the supply of our vaccines. Verheri said that we'll have to see by July if our supplies will get stabilized. Then we could probably start the inoculation for the B and C groups. But for now, the priority really is the A groups, for they are more vulnerable to get infected and hospitalized, Charles.
Right. Could you tell us now how many vaccine doses specifically are allocated for A4 residents within the NCR plus 8?
Yes, Charles. The government initially allocated 22 million doses for the A4 sector, but they will do it by phase. So for now, the inoculation for A4 group will only be for the 12 million individuals who are living in NCR plus 8. And based on the AI or IHCF resolution, the inoculation for A4 group may also be stratified according to age. So meaning the LGU may inoculate first the oldest age group, but that will also depend on the supply of our vaccines, Charles.
All right, so much for the NCR plus 8. Let's talk about the surge in Davao City. We have the OCTA recently warning that the COVID-19 cases in Davao City are projected to surpass that of Quezon City by next week. What was the Department of Health's reaction to this?
Well, Charles Verheri said that the OCTA research is also getting their data from the health department. So they basically have the same data unless OCTA will present a model. Now, the DOH is yet to verify the cases in DAVAO. If it indeed has an increase in cases, that will surpass the numbers in Quezon City. Now, with regard to the cases in Metro Manila, the DOH confirms that there is really a decrease in cases in NCR. Before, the NCR's share in COVID cases is at 30 to 40%, but now it is only at 13%. Mindanao has 25%, Visayas has 20%, and the highest is in some parts of Luzon, like regions 4A, 4B, 5, 3, and CAR, which comprise the 40% overall share of COVID cases in the country. Charles?
Right, Jen, noting the downtrend in the NCR and the surge in Davao City, will the government now start deploying health workers from NCR to provinces to deal with the surge in cases outside the NCR?
Well, Charles, that is one of the strategies that the government may do, but Verheri says that they have to assess the condition here in NCR first before deploying healthcare workers to provinces, because although cases here in NCR are decreasing, our hospitals are still in moderate risk. However, our government has been constantly doing interventions and support to provinces with high number of cases, such as giving medical supplies and medicines, and also by giving additional funds. Charles?
All right, Jen, we have a bunch of vaccines that are set to arrive in the Philippines. Do we have any updates on the EUA application of Sinopharm?
Well, Charles, Yusek Verheri says that an intent to apply for an EUA for a SINOPHARM in the country has been submitted through DOH, but they have no information yet if there is a private manufacturer who applied for an EUA for a SINOPHARM. Charles?
All right, thanks for those updates, Jen. That was Jen Calimon reporting live from Malabon. Here are other stories we are keeping our eyes on. A bill filed at the lower house questions the tax rate hike on private schools under the newly enacted CREATE law. Deputy Speaker Rufus Rodriguez says the BIR's move to increase private school taxes from 10 to 25% is illegal under the Constitution, which mandates the state to make education accessible to all. The lawmaker warns that with a 25% tax hike, 25% tax rather, more educational institutions might be forced to close down or increase tuition fees. The NBI has filed criminal charges together with BPI against former Wirecard COO Jan Marsalek and lawyer Mark Tolentino, among others. This over violations of the General Banking Act in relation to the Cybercrime Prevention Act. Wirecard was accused of global fraud after collapsing last June, owing creditors almost $4 billion. At one point, the firm claimed it kept more than $2 billion in two Philippine banks, BPI and BDO, which was denied by both the lenders and the central bank. And in celebration of Pride Month, Vice President Leni Robredo voices her support for the LGBTQ+ community, saying they have provided a shelter to the oppressed and a voice to the marginalized. She noted, however, that challenges still exist for the community, including lack of access to employment and healthcare, as well as threats of discrimination and violence. Robredo calls on the Filipino society to intensify its efforts to be more inclusive beyond Pride Month. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Charles Lejano. We are One News.